Welcome back to Bridging the Gap, the Nelson and Associates Insurance Podcast. We're here today with our precious Morgan. Morgan is our dental and vision agent, and it's so good to have you with us this morning, Morgan.
Hi.
Hi.
It's so good to be here.
Good. A few years ago, you started out as a volunteer, and now you're running the dental and vision department. So, we want to talk to you today about things that you come into contact with in the dental office, or the dental insurance office, not the dental office. So, why don't you open and share what you do and what plans, like dental specific, what products are available. Tell us what companies we represent with dental insurance.
Okay, so the products that we offer to our clients here at Nelson and Associates, we offer Florida Blue, we offer Cigna Dental, Delta Dental, Aetna, Humana, and I believe that's all right now. We're always open to getting appointed with more, and I've really just focused on those products recently, and we offer a comprehensive amount of plans with waiting periods, some without, some with higher annual maximums for our clients, some with lower. It all is based on really your own needs when it comes to dental. A lot of times people need maybe more major services. Some people come in and they just need a basic plan. We cover children, adults, all the way up, and you can even have it coincided with your Medicare.
Sure.
So we offer a great amount of
Yeah. So
plans.
tell us a little bit. You kind of touched or said some words that I kind of want our audience to know. You mentioned basic service, and then you mentioned major services.
Yes.
So, if in a nutshell, tell us what is considered. I mean, and I know we're not dental offices, and by far we're not insurance companies as far as the providers, but we are dental agents. And so tell what your knowledge is, or share with us what a basic dental visit looks like.
Okay, so typically, so in your summary of benefits, there's a breakdown, and that's preventative, basic, and major. And if you're just going in for a normal checkup at the dentist, it's typically just your cleanings and x-rays. And majority of times under your summary of benefits, those are listed as preventative care, and that's
Okay.
covered at 100%. Some x-rays are not always covered at 100%. It depends if it's bite wing or if it is total complete mouth. Those
Sure.
typically fall under basic services, and
Okay.
basic services are considered your, depending on plan too, it varies. So it can be your crowns, bridges, and also any fillings.
Like
Yes,
fillings.
like
Yeah.
fillings.
Yeah.
So if you come, but typically just a basic visit to the dentist is going to be your exam and your cleanings, and they're going to
Sure.
overall tell you maybe what you need in the future, and that's what a dental plan will be beneficial to you for.
Sure.
And even if you have a dental plan, I say it's very beneficial just for if those 2 cleanings a year, 6 months periods, you're getting your money's worth with a dental plan.
Yeah.
Yes.
So, thinking about preventative, all you guys all know in our office that I always say preventative is cheaper than treatment.
Yes, it is.
So it's very important that you have at least a basic plan, if for nothing else, then to at least get a cleaning and get x-rays.
Yes.
2 times a year, basically.
Yes.
For children, I know when I was, oh my gosh, 4, I think, I had to have major treatment in my mouth because I took a bottle so long. And I had to have I think 2 root canals even at 4 years old. It was very traumatic because
Mhm.
back in that day, they did not have what they have available today.
Mhm.
So, which obviously caused me to have great anxiety when I go to the dentist now
Yes.
as an adult. But when I started having children, one of the things that was offered that was not offered in my childhood was the sealants
Yes.
and then the fluoride treatments.
Mhm.
Can you tell us for kids
Mhm.
and for basic coverage,
Yes.
are those types of things included normally
Mhm.
or on average in a basic dental plan?
Yes, they are, and they are typically, if not 100% covered, um, fairly covered completely. And they actually, we offer a Florida Blue plan that has great pediatric benefits for under 19,
Okay.
and for fluoride treatments and sealants, those are almost completely covered, typically based on plan.
And the sealant, I believe, is on the baby tooth, not the permanent tooth, or is it on the permanent? I think maybe it does go on the permanent. I'm not
I,
sure. We'll have
I
to
would
get a
have to look
dentist
into
office in
that.
here and ask
Yes,
them
I'll
that
have to
question.
call them and ask them that.
I can tell you though that when my kids were little,
Hmm.
we did the sealants and very rarely did they have cavities.
Hmm.
It is sort of a preventative
Yes.
because if you think about what is included in a preventative, X-rays, cleanings,
Hmm.
some feel maybe fillings, depends on
Yeah, it really depends on plan. But
right,
yes, with that preventative care, protecting your oral health protects your overall health
right,
in life. And just, I personally have had sealants, and those kept me from getting cavities. And
sure,
just prevention is key when it comes to oral health.
yes,
And when it comes to your filling, sealants, fluoride treatments, that's preventing you from those cavities. And
sure,
with something that's full coverage, why not take advantage of it?
sure,
And for kids, it's definitely something to look into, because I know as a child, I've had to have a few fillings. And
yeah.
if we had those sealant treatments, those were great for me whenever I needed.
Yeah. So, and you said something really valuable. If you have it, use it.
Yes,
You
if you have
know,
it, use it.
I think a lot of times people purchase a
Mhm.
type of insurance plan but they never use it. And then
Correct.
they don't understand why they have to continue to pay the monthly premium or the
Hmm.
annual premium. And dental insurance can be extremely cost effective
It can.
with basic services that keep, like you said, I love what you said when you said, if your mouth is healthy, then the rest of your body is healthy.
Yes.
If you've ever had a toothache,
Hmm.
you know what that feels like. If
It's
you've
not fun.
ever, I know for me, there were times where this is so silly, but I would be in a car and the air conditioning vent would be blowing in my face. And then after a while, the air dries out, your tooth and then the cold air and
Hmm.
it kind of stings a little, like it kind of
Yes.
hurts. And so those types of things are extremely valuable. Having your teeth clean, I know it's not, everybody feels like, oh, I have to go to the dentist. But when you
Right.
leave from a cleaning, you
Mhm.
always feel like, wow, I feel so fresh and clean. I can
Yes.
smile more. And I know that smiles,
Is a part of confidence, and just in your
yes.
everyday life, a smile is the first thing people see, and protecting that is
Yes,
key.
Morgan, as
Hmm.
a former beauty queen,
Yes,
here
ma'am.
right here in Nassau County, you were
Miss Warrior.
Miss
Yes, ma'am.
Warrior when she was at West Nassau High School,
My senior year.
her
Yes, ma'am.
senior year, and you've been in multiple beauty pageants.
Yes, ma'am, I have.
So you agree that the smile
The
is
smile is
extremely
cute.
important.
Yes.
Not being able to smile is miserable.
It is.
Um,
It's a confidence thing for sure.
Absolutely,
Hmm.
absolutely. I think it helps, in life, in all aspects, from personal to professional.
Hmm.
So it's very important. So I just wanted to say thank you. So if you are watching or if you're listening and you are afraid to go to the dentist, but you still want to be able to smile, and you need to get your teeth cleaned, at least at minimum, give Morgan a call. She's here in our office. Our office number is 904 326 3288. And Morgan's extension
Is 105.
is 105. And you can reach out to Morgan. Just tell her, hey, I want to get a basic plan just to get my teeth cleaned and get my x-rays. But you have to start somewhere. Would you agree?
Yeah, I do agree.
Some people don't know what they need done.
Correct.
But everybody knows when you need to be cleaned.
Yes.
Right? I think
Yes.
that's fair.
It's come in and we can start you off with something basic, and if you realize you may need something with more coverage, we can always reconvene. So
Yes.
that's what I'm here for.
And that's awesome. So give Morgan a call. Come by and see her. She's got her boss shoes on today, so she could probably really help you out a lot today. But Morgan,
ma'am.
thank you for being with us. It's
Thank
always a
you.
pleasure. Tune in next time on Bridging the Gap, where we'll dive deeper into dental and vision plans with Morgan Wilson, our dental and vision agent, right here at Nelson and Associates Insurance. Thank you for joining us.